Welcome to Impact by Diffa Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hi, welcome to our next episode of Impact. Today, we're going to be talking about HIV Testing Day and all the details you need to know about HIV testing and what you can do. I'm happy to be joined today by two special guests. We have JP from the Nelson-Tebedo Clinic, and we have Dax from Prism Health. So welcome, guys.
Hi. Thank you for having us.
Great. So we're going to start just telling us a little bit about you. So JP, why don't we start with you and then we'll come to Dax.
Absolutely. Well, thank you for having us first, Tim. And my name is JP Cano. I'm the Prevention Services Manager for the Research Center, specifically at Nelson-Tebedo Clinic. I've been the Research Center for about 11 years. I manage pretty much all the prevention services, which is testing. We do treatment for STIs. We also provide a PrEP program, pre-exposure prophylaxis program, and then we have a gender-affirming care program and a condom distribution. I'm a nurse, that's my background, and I work with the community that I'm part of, and I'm very proud of working with the LGBT community for sure.
Awesome. Dax, tell us about you.
So I work for Prism. I am a behavioral intervention specialist. I work in the Project Connect program. So we do HIV testing, counseling. We link people to PrEP, we get them connected to different services, mental health services, substance use, stuff like that. So I'm an outreach worker, so I'm usually out in the community testing people and taking care of that. I've been doing this for like 3 years, but I've been with Prism for 1.
Awesome.
So
awesome. Well, I'm glad you guys are here. I think this is an important topic for today. Tomorrow is HIV Testing Day, so it's important that we talk about it, and especially North Texas, it's one of the highest HIV infection rates in the country, one of the highest. And I think it's, an important topic that we try to figure out. How do we reduce stigma? How do we let people know how they can get tested? Because that's key in prevention and reducing your own risk. So why don't we talk a little bit about HIV Testing Day? And maybe we'll start with you, Dax, around what is Prism doing around HIV Testing Day?
It's a very important day. I think everyone likes kind of a holiday where they can go do the thing that it's dedicated to. So we are actually holding an event over at our Oak Lawn Clinic. We've got 3 clinics in Dallas. This one is 2801 Lemon Avenue. So it's right there by the Strip. So you can go on HIV Testing Day tomorrow, and we're offering free rapid testing. So obviously we're going to still be doing all of the safety precautions given the pandemic and everything, but you can totally come by and get tested with us.
Okay.
Is that good?
Yeah, that's great. JP, tell us about you guys.
National HIV Testing Day is always a really important date for, I think, not only for our agency, but pretty much all the agencies in Texas that work on the HIV. And it's a reminder. It's a reminder for individuals to get tested. I think it is important that individuals have that knowledge because a lot of people have HIV and they don't know the status, which is really, really important. And again, we at Nelson-Tebedo, we offer testing pretty much all year long. Saturday, we will provide, I think we're going to provide some baggies to people that come in to get tested, again, just to recognize the day. But again, it's a reminder. It's just a reminder that you need to get tested at least every 3 to 6 months, which is the recommendation by the CDC. So that's one of the things that we're going to do. Probably we're going to be on social media promoting testing because, again, it's not only that day. People need to get tested and know their status.
Yeah. So let's talk a little bit about that. You said a lot of people may have HIV, don't even know it. I know there's some stats around that which are relatively staggering. But why else is it important to get tested, right? There might be some people that say, I don't think I'm at risk. There might be some people that are scared to get tested. So let's talk about just the importance of testing, why it's important for you as an individual, but also why it's important for the community and those around you and your partners. So do you want to start, JP?
Well, I think we are in 2020 and we still have a lot of stigma, which is one of the big problems that we have. Individuals don't really want to be known as, oh, I got tested, because obviously it's related to having sex. So it's something that we don't talk, especially in a state like Texas. So if you want to admit that you got tested, is because you're having sex. I think the risk is pretty much everybody that has sex. It doesn't matter if you do it once or you do it 1,000 times. So it is important that you know your status. Again, most of the individuals that transmit HIV is because they don't know the status. Somebody that has HIV positive or a person that is actually already diagnosed is more careful and actually tells their partners that has been pretty much known in the statistics. So it is important that people know the status. So again, it's stigma, of course. In Texas, we have some other barriers like language, for example. Some people that don't speak English don't want to get tested. We have seen a lot of numbers, high numbers in the Latinx community, especially the past 2 years. So again, we have all these barriers that we continue to challenge and try to remove for people to get tested.
And I think that's an important fact is if you do get tested and you are positive and you actually start to get on medication, right? And you bring your viral load to undetectable, then you can actually transmit it to someone else. Right. And I think when we talk about reducing risk in the community, not only is that important for you as an individual, but it's important for everyone around you. Right. And that's how we eventually will get to a point of zero. Right. At some point, I mean, obviously there's other factors that go into it, but tell us a little bit about your point of view around, why testing is important and why people should go get tested.
I mean, testing is so important because it gives you that kind of sense of control over your body and what's going on with you. And I think just getting tested and being open about it does fight that stigma. I know we're going to talk about stigma a little bit later, but it's so pervasive that it's really hard not to jump right in there. It's this story people tell themselves about something when they don't really have all the facts. And so when you do get tested and you are open about it and it's not so much of a thing, then you're giving other people the ability to see that, this isn't this terrifying thing. STIs are not so much, they're just kind of an inevitability, that's just the world we're living in. So when we're all getting tested and we all know our status and we're all, I feel like I'm rambling, taking care of ourselves, it becomes less scary. So
let's talk a little bit about stigma, right? And I know, JP, you mentioned it a little bit. Stigma in the community around being tested. I think even in some communities, there's even some subsets of the community, there's even greater stigma. Let's talk about why the stigma exists and maybe what we can be doing better from our own organizations, but also, as allies in the community, to friends, to help eliminate that stigma.
I'm going to say that stigma starts with at home. It starts with your small circles, with your friends. I think it is important, especially in the LGBT community, which a lot of gay male get affected by HIV, to have an open conversation. Sometimes you are in a group of friends and that is something that are not really comes up to the conversation. Always somebody brings it up, it goes around and never goes to a really focus of what is really, really important. So I think it starts in there. I think stigma, it's to start eliminating that stigma, you have to start talking to friends, to have that conversation. I think DIFA has a big conversation created around HIV, which is really important. I know from the years that I participated through DIFA, it's not only about just the event, it's about that conversation that goes behind, and obviously about all the agencies that work on HIV and by those affected by HIV for sure. So I think that's one of the main goals. Pretty much starting the conversation is pretty easy. We, especially in Dallas, we have not only HIV rates that are rocketing, and we have some other STIs like gonorrhea, like chlamydia. If you see numbers, I mean, we have very high numbers. And people come like our clinic and get tested and say, you know what, I have a discharge. And then you talked about HIV and there's still that stigma there. Oh, I don't know if I really want to test for that. Yeah. So you have to make understand how important that is to have that test and have that knowledge for sure.
Yeah. I think it's also like important. Like a lot of times people will say, like, don't be reactive, be proactive. But I think it's really important to know how to react when you're in the presence of somebody saying like a sideways joke that doesn't, that's not cute, and not to be, don't be afraid to address that with your friends and find a compassionate way to start a dialogue when somebody says something like full-blown AIDS or something. And like, we don't say that, just try to, be compassionate and react when you see it, and don't think about how like, oh, I'll get that next time, or somebody will get that. You got to get that. It's kind of our responsibility to teach each other.
So let's talk a little bit about, obviously men who have sex with men is one of the largest populations that's impacted. Mm-hmm. But we also know that Black women are disproportionately impacted when it comes to HIV.
Yeah.
And there's tremendous amounts of stigma, in that community. So what would we say to anyone, maybe that's not a man who has sex with another man, around the importance of getting a test for HIV?
Well, I think a lot of people still today have this mindset where it's this, this gay disease, or and it's not, like I tried to give blood one time, and I went through the whole thing, and they were really excited about my O blood, and they were like, cool, yeah, and then I answered some of the questions, and they were like, actually, no. And I was kind of taken aback by that. And it's not about the orientation of the person and that association with HIV. It's these behaviors, it's things that you kind of take part in. And when people kind of understand that it's called human immunodeficiency for a reason, and not like gay or so it's about the behavior. And when you kind of make it that broad human thing, I think it's a little easier to digest.
Sure.
Yeah,
that's great. JP, any thoughts from you?
Yeah, well, you mentioned about Black women in high numbers. I think it has to do a lot with culture. I think it's important to address specific populations on their specific culture and specific messaging. It is really, really important. Women, as Dax is saying, don't have been linked too much to be affected by HIV. Up until recent years, especially Black women. Mm-hmm. So it is important to create those messages specifically for those individuals. Yeah. So, because again, yes, most of the individuals that have been affected are MSM, especially Black and brown folks. So it's important also that we have a different branch. There's some agencies that targeted that population specifically. So it is important to pretty much either make a referral to that agency or to work together with that agency to target that population. Another population that is really affected also is Black trans women. Mm-hmm. And it's also very, very difficult sometimes for folks to engage with this amazing community. And we know now that there's some other determinants that it's affecting this community. Not only, obviously, the racial war that we have currently. So if we talk about HIV, you're pretty much having more layers to that onion. Mm-hmm. So it is important to tackle those messages very specific for those communities.
Sure. So, let's assume we can overcome stigma. People are like, hey, I think it's time to go. Where can people go and get tested? Like, what are some of the locations? We'll start with you, JP.
Well, we offer testing in Nelson-Tebedo Monday through Saturday.
And where is that for people?
It is on 4012 Cedar Springs, which is right there in the heart of the Oakmont area. Mm-hmm. We've been, again, we test in there. We start at 9 o'clock up until 6 o'clock. Obviously, the pandemic has changed some of our scheduling. We used to do walk-ins on Thursdays. We're not doing that at the moment. And it is important to talk about COVID at this point. I think maybe you will ask something, but we have had pretty much put some policies in place and procedures pretty much for COVID. And we do testing in there. We do some outreach. Honestly, right now with COVID, it's have been very minimized to do outreach. We used to do it at bars, we do it at bathhouses. Mm-hmm. But again, with COVID, that has been a challenge. We're going a little bit more on social media to try to set up those messages and people to come in and get tested. But besides that, that testing, that's what we do.
Okay. Yeah. Prism.
Prism, we've got 3 clinics in Dallas. We've got one on Oak Lawn, the 2801 Lemon. I say Oak Lawn, it's on Lemon. And 2 days out of the week, we do testing there. We also have a trans clinic. And then 5 days out of the week, we have a clinic in Oak Cliff and then one in South Dallas. And their addresses are 219 Sunset Avenue for the Oak Cliff one, and then 4922 Spring Avenue and South Dallas. And we do testing there. We do free STI testing, free HIV testing, and our treatment is at like little to no cost. So.
And I think that's great. I know some people are always a little hesitant about the cost. You know, people, especially right now, COVID, are living paycheck to paycheck, and so having something that's free or low cost or covered by insurance, I think is really important. And I know it's great that both of you guys or your groups are providing testing, but people should also know they can get tested through their doctor, right? They can get tested other places. But the great thing about Nelson-Tebedo and Prism is it's so specialized. You guys are working with these cases all the time. Yeah. Right? You know what to share. You know how to make people feel comfortable. And you know that people in the clinic are not going to be, putting thoughts or judgment on other people. So I think there's some sort of comfortability with, going to Prism or going to Nelson-Tebedo.
Absolutely.
Yeah. So let's talk a little bit about how testing works, right? Okay. Maybe part of the stigma is around not really understanding what the process is. JP, I know you brought, a little bit of a kit. So why don't you kind of walk us through that process?
There is a different type of testing, obviously, rapid testing specifically. So when somebody needs to get tested, they really need to know what type of testing they're looking for, and how far they want to go on their exposure. There's this idea that when I get a rapid test, I'm going to know what my results are just from what happened today. Yeah. And that is not true. Every single test, depending on the brand, depending on what generation they are, they have a window period. So especially rapid testing, most of them look for antibodies, which again, it takes a little time for your body to create antibodies. So just to give you a quick explanation of how that happens when somebody gets infected, obviously there is a response. There's an immune response from your body. And it takes around 7 to 11 days to create those antibodies. So there's not really a rapid test that can find the RNA test. So there is some an antibody tests like the rapids that can look for those antibodies. There is an RNA test that is manufactured to actually have to draw blood for that. But the rapid testing is still really good. If I had an exposure 2 months ago, this test could actually tell us if you were infected. And it's pretty simple. In our clinic, this is one of, I don't know if I can say a brand, but this is CanBio. And this is the rapid testing that we do. We every single client that comes to our clinic, not only receives a rapid, but we also do the RNA test. Okay. Again, the RNA test is not a rapid, but it will give you that window period of 11 days and before. Okay. So if you were exposed 2 weeks ago, this rapid is not going to tell you the results, but the RNA will give you the results more specifically. So it's good for a peace of mind. Again, if you had exposure 2 weeks ago, this test will not give you the results. Sure. And it's pretty simple. There's pretty much, and I can show you here. There's pretty much, I'm going to say a little.
We need to hold it up a little bit.
There you go. Sorry. Yeah. I don't know if you can see it. But there's a little. I might over here. This is the CanBio HIV 1-2 step back. And it has a little, I'm going to say, plastic where you pretty much put the blood in and it gives you the results between 10 to 15 minutes. Okay. Pretty simple. You just add a drop of a sample and then you have to put a buffer in there. In 10 to 15 minutes you get the result. Pretty simple.
Yeah, very simple. Now, are there over-the-counter, can you buy rapid HIV tests at a Walgreens or any type of over-the-counter? And is that process different?
The process is similar, but it is a lot more expensive, I think. Yeah. So that's why it's important to know what resources you have available. But what were you saying?
It is available. Actually, I think pharmacies offer rapids. I don't think they offer a rapid testing with blood sample. I think it is a swab. Yeah. Texas, the city, the Texas Department of Health has not really accepted that as a definitive test. Obviously, not even this rapid test is a definitive. If somebody is reactive, it's called presumptive positive. So you still need to do a blood draw. So it is available. Just like Dax said, it might be more expensive. However, we're in COVID times. There's a little push right now for doing more home testing. Again, for people that don't really want to leave their house, I think it is an option. For people that don't want to go and be in big crowds or don't want to travel, they can go and buy it. Again, it is not cheap. I don't really know what is the price, but like places like ours, we offer it for free. So it's might be just a walk, maybe take the bus, but it is for free. But it is offered. It is offered, and again, COVID times. There is a push for doing more home testing. For sure.
Yeah, the accuracy of these is obviously much better, right? So that's an important thing to know. But if there is some uncomfortability and people have that built up anxiety, they can start with something at home if they want to, as long as the cost isn't prohibitive.
Exactly. Yeah, and it is important, again, you have to, if you're going to do a rapid test at home for people that is seeing this, I mean, they really need to see what is the window period. Because if they say, oh yeah, I had exposure yesterday, I'm going to do a rapid, that's not going to be a useless test.
Yeah. You know, I think one of the concerns, especially on the stigma side around getting tested, is what the result will be, right? So Dax, why don't you talk a little bit around what's the process after, right? So you get your test results back, either you're negative or you're positive. Okay. What's the next step?
All right. So the more common result is, if you're negative, typically you'll be dealing with somebody like me, a behavioral intervention specialist, a risk reduction specialist. And, not only do we test you and we give you your status, but we walk you through other combination prevention methods that you can take on to help protect yourself. So, not everybody uses condoms, and you're never going to get any judgment from your tester about that, So my job would be to kind of guide you and direct you to some other things that you could do to help keep yourself safe. If you're having anal sex, use lots of lube. That will reduce friction and tearing, and it's a thing that you can do. So I'm never gonna, be mad at you for any risk reduction step that you take. Although there is kind of a hierarchy as far as what's more effective. But if you're negative, great. You're negative, awesome. What else can we do to make sure that you stay safe? And we'll kind of go through that sort of conversation. In the event that you're positive, we really want to make sure that we're here for you and we can get you connected to care, because that's going to be the priority, is making sure that you're connected to medical care, and kind of talking you through that and letting you know that it's okay. Like, we've got counseling available, like, it's going to be okay. I think that's the bottom line is, a lot of people think, oh, this is the end. They can't fathom what's going to happen. And just, in the event that were to happen, just ask lots of questions, so don't be afraid. We're here. I think I answered.
No, you did. And I think that's so important, right? It's okay.
Yeah.
Right. There's a whole community,
Absolutely.
And I've learned this coming through my years at DIFA, but there's a whole community that's there to support and is available to you. And a lot of times you're just scared of am I the only one, right? I don't know any other people that are HIV positive, but that doesn't necessarily mean that's the case. You probably do.
Oh, you absolutely do.
Right? And so understanding, what are the next steps of, okay, how do I get help? How do I make sure that I'm taking the next step in my health? And also realizing that there's a whole community available to support me and I'm not alone. JP, any thoughts from you?
Yeah, what we were talking, we were just going around about the stigma. So believe it or not, there's people that say, you know what, I don't want to know my status because I don't want to know that I'm positive. I might be okay knowing that I'm going to be negative, but if I am positive, I don't want to know. So again, we go back to that stigma, and just like Dax mentioned, our main goal for people that we work doing diagnosis is for you to take care of yourself, for you to find a physician, for you to know that. I mean, I know many people that are affected by HIV, and they're the most healthy individuals that I can see. Yeah. So it is not at that sentence. We are not in the 90s anymore. gladly, we have a lot of medications that pretty much help for individuals to stay in a viral load that is pretty much, somebody that's HIV positive, person affected with HIV. Nowadays, they have the same life expectancy that anybody else that is not, which is huge. Again, people is still as afraid to die from HIV. So it is important that they know that there is tons of resources. You just mentioned it. Texas, we offer a lot of resources for individuals that they need to know their status, they need to actually have a test. If for those individuals that are undocumented, there's still resources for them. A lot of the individuals in the Latinx community, especially they're immigrants, they don't want to get tested because first, they don't want to go to a hospital that they're going to ask for documentation. Second, they think they're not going to be served. So that's a completely urban legend. They gonna be served, especially if you're HIV positive. You are gonna be served and you're gonna be taken care of.
Yeah. So for more information, JP, where can people go find out more about the Nelson-Tebedo Clinic?
Well, we have tons of information not only about HIV testing, but all the services that we provide at researchcenter.org. There is a section there for testing. Not only for HIV testing, we have, I think I mentioned before, a PrEP program, which again, it's an amazing behavioral intervention now to prevent HIV. So it is important that people get into PrEP. If you are not going to use condoms, it is important that you are on PrEP. Obviously, it is encouraged to use condoms even when you are on PrEP. But again, there is another weapon that we have against HIV. We have a gender affirming care program, also information in there in the website. We do have a Facebook page, Nelson-Tebedo. You can just look into Facebook and look for information. It's more specific just for testing and the programs that we provide in Nelson-Tebedo. But those are the places. I know we have an Instagram account for the research center. But again, the more specific that we have is for Nelson-Tebedo. And all information there and updates that we have, especially during COVID, closings and our times are there.
Okay, great. And Dax, tell us about Prism. Where can people find more information?
So our website is phnTX.org. So you can kind of be directed to a lot of the things we're doing from there. We've also got an Instagram and a Facebook that you can look up. Admittedly, I don't know exactly what our Instagram handle is.
Okay.
But, aside from just those traditional online ways that you can reach us, Project Connect is also present on a lot of the dating apps, so I'm on Grindr, Scruff, Adam for Adam. You'll see me on Jacked sometimes, and I am there to answer any of your questions, to get you connected to PrEP, to if something itches down there, girl, talk to me. I will tell you where you can go, what's going to happen. I'm there for you. Okay. So, and a number of other people on our team are also doing that. We've got PrEP coordinators doing it too. So, if you see us, say hi, we're out there. That's kind of our digital bar right now. So you can kind of reach us those ways.
Awesome. Dax, JP, thank you guys so much for being here to talk about HIV and HIV testing. I'm so happy that DIFA is able to work with great organizations like Nelson-Tebedo and the Resource Center and Prism. So thank you guys for being here.
Thank you.
Thank you so much.
Awesome. All right, everybody. Thanks so much for tuning in to this episode of Impact. I hope you were able to learn a little bit about HIV and HIV testing. Don't forget to go get tested, and we will see you on our next episode. Thanks so much.